Hi, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. We are on video 2 of our knee pain series. We're going to go over some ways to diagnose it at home, things that you can do to kind of differentiate the cause, and then in video 3 we're going to go over some things you can do at home to help alleviate some of that pain. So when we were in video 1, we went over a couple of the causes of knee pain. Now, certainly the 3 that we went over, not the only causes, but they are some of the big 3 that we see. This is our second video, so today we're going to go over kind of how we're going to differentiate between those 3 causes. So thank you for taking the time to watch this video, take this course. It's it's really important to understand how or what's causing your pain, your knee pain specifically, and kind of watching these videos is the first step. Now, what I'm going to tell you is you may fit into all 3 of these categories. So if you are going to do this at home and you're going to kind of test for a couple things, you may not fit nice and neatly into one category. You may fit into 1 or 2 categories or all 3 categories, all right? So don't be alarmed if you don't fit nice and pristinely into one, and don't think your knee is completely messed up if you fit into all 3, all right? Most of what we see, most people fit into 2 or 3 different categories, especially the longer that you've let this go on, the longer this has been hurting, the more categories you're going to fit into. So don't be alarmed with that. The other thing that I'm going to tell you before we get started is don't split hairs. So that means, look for the obvious. You can convince your mind of almost anything. So if you do one of these tests and, you're like, I think I kind of felt pain, maybe it's what she thought, maybe it's what I think I should be feeling, the answer is no, you're not feeling it, all right? You have to be able to really get a positive result, meaning pain, or there is no gray area here. So if you're trying to convince yourself, or you're sitting there going, I think, the answer is no, the test is not positive. No, you didn't find anything out from that test, which is normal, okay? It's not uncommon. So just be aware of those things. I know people get themselves into kind of some issues, even therapists sometimes, because you start to split hairs. The obvious is the obvious, so kind of take it as that. So first we're going to go over some things to do with meniscus. So meniscus is the padding in between this bone in your femur and the tibia in your leg. So what that does is, as over time, it can get worn down. So a lot of you watching this video may have had a meniscus tear in the past, or maybe even have a meniscus tear that the doctor says, we're not going to go in and fix it. Some of you might have had your meniscus removed, but either way, the meniscus is just that padding in between the knee joints. So what happens is that can wear away over time. So if you have an MRI and it says meniscus tear, and the doctor says, you know what, it's too small, we're not going to go in and get it. A lot of times, physical therapy is the route that they choose to send you on, and then that can, relatively get you pain-free. Now, you'll sometimes hear a lot of clicking with the meniscus, and it'll be really hard to turn and pivot. So what you want to do is you want to test by standing on the leg that you think is affected, and you're just going to spin that knee, okay? So you're almost grinding that knee back and forth, okay? So you're going to actually kind of grind on the meniscus, all right? So just basically, and you're going to run your knee in and out over that meniscus. If you feel some pain or catches you, you most likely have a meniscus tear. Now, the fact that it's bothering you, or you feel some pain, you might want to seek an MRI or see an orthopod, or come in and get it further diagnosed by a physical therapist to confirm that it is. Sometimes when meniscus tears are big enough, surgery is required. There's no way at home to figure out if you got a big or a little tear, and that needs to be done through imaging, through some hands-on type of work. But that's just a very kind of quick and easy way to do it. You can also have both feet on the ground and do the same thing. Just put a little weight on there, kind of spin from side to side. A lot of times when I ask people to do this, or when I do this, people are very hesitant because they're like, I know this is going to hurt. So if that's you, that generally means there is a meniscus tear going on. You know, most people know that planning and turning bothers them if they have a meniscus tear. So usually, even if I ask people to do something like this, if I'm out and about evaluating people, and they wind up saying, no, I know that's going to hurt, there's a positive meniscus tear. If you do this and you're like, I think it bothers me a little, it's not a meniscus tear, okay? So it doesn't mean that there's not a small one in there, but if you're not really lighting up with that test, then that's not positive of meniscus tear. So the second thing is the patellofemoral syndrome. So there's a lot of things that encompass patellofemoral syndrome, and I've seen it diagnosed and I've seen it written a bunch of different ways from doctors' offices and things like that. This is not tendonitis. This is specifically something to do with the kneecap, all right? So I do get inquiries time to time. People say, I have patellofemoral syndrome tendonitis. So that's not, they're two separate things. We're going to get into the muscle thing a little bit in a little bit. But patellofemoral syndrome is basically the kneecap just grinding. And with that kneecap grinding, you want to figure out, there's not much we can do if that's the only source of pain. Now, your kneecap could be grinding due to tracking issues, which I'm going to go through in just a second. So there could be a couple of reasons why your kneecap is grinding, but if once that surface wears away, there's not a whole lot that can be done. So, keep that in mind, but generally, I can honestly say maybe 1 or 2 times in probably 10,000 knees that I've treated, is it solely patellofemoral syndrome? Is it solely wearing away of the back of that kneecap that causes the pain? It's usually a lot of other things. So with this, you're going to do 2 separate tests. So what you're going to do is you're just going to sit on a table and keep your legs straight out, okay? You're going to hold your kneecap down, okay? And all you're going to do is you're just going to kind of press it in, and then you're going to push the back of your knee into the table. So you're extending your leg, all right? And you're going to hold that down. Now, if you feel some crackling, if you feel some popping, that's kind of normal. But if you feel pain, that's not normal. So it might be uncomfortable because this is not a comfortable thing to do. That is indicative of patellofemoral syndrome. Again, if it's uncomfortable, you don't really want to do it, but it's just, it's not, okay? It just means you don't want to jam your patella into the back of your leg. Another thing you can do is you hold your 2 fingers in parallel and do the same thing, okay? Push the back of your knee into the table, extending your leg. What you're going to watch for is that patella should slide up and down in between your 2 fingers. Someone who has some tracking issues, as we call it, their patella will actually start to go off this way. All right, so when they extend their leg, instead of it going up and down nice and straight, it's going to go, you're going to feel your kneecap come over into your hand or over into this finger a little bit more. That's another indication of patellofemoral syndrome, but it's also an indication of there's a tracking issue going on that we need to do something about. Finally, the muscle piece. So when you talk about the knee, as we kind of covered already in the diagnostic, in the anatomy portion, in the anatomy video, we've said the knee is the hub. The knee has a lot of different muscles that come in and attach to it. So it's not uncommon for quadricep tendonitis, IT band tendonitis, all these itises, all these inflammations in the muscle that come in and insert at the knee to become inflamed. So one of the things that you can check for is you're going to take your knuckle and you're just going to put it into the side of your leg. All right? Not the top, but go right in on the side. This is where the IT band is. And you want to go up and down, close to the knee as you can, and then just start working your way up. Now, if you're pushing as hard as you can, and you're like, I don't feel anything, you're fine, okay? Chances are it's not a muscle issue. Now, granted, there's the hamstrings in the back that you can do the same thing to. You can take your fingers and push them into the hamstring. Now, you want to make sure when you do this, that your leg is relaxed. If you're contracting your muscles at all, it's going to push your fingers right out. So you want to make sure your leg is nice and relaxed and get your fingers, I guess I hit a spot there, that hurt, into your hamstring. When you do it, if you have no problem, if there's no trigger point, if there's no muscle involvement, it's going to feel like you are pushing muscle. Many, many times I have heard, you know what, it only hurts because you're driving your knuckle into it. It's not the case. If you go to the other side, if the other side is actually healthy, and you push your knuckle into it, it's not going to hurt. Or you take your fingers and you push them into the back of your leg, into your hamstring, it's just going to feel like someone's pushing their fingers into the back of your hamstring. It's not going to feel painful. It's just going to feel like a kneading, you know, kind of like a massage. Somebody's rubbing your leg. Not painful, just, hey, thanks for the massage. When you push on it and you're like, that hurts, it's not because someone's pushing on it or how hard they're pushing on it. There's a problem there. There's something going on underneath that issue. And with tendonitis, one of the things you have to realize is it is indicative of something going on elsewhere. So if you have quadricep tendonitis, the quadricep is being overused. So you don't just want to treat the quadricep. You don't just want to treat the quadricep tendon because you're doing yourself an injustice. You've got to find out why that quad is working so hard. Is it a weak glute area? Is it a weak hamstring area? Do you have an issue, you know, with how you land when you run? There's several different reasons on why tendonitis is there. And one of the things that you do want to always kind of question and figure out is, you know, what caused it? And that's why, you know, you're watching this video is to figure out, you know, the cause of your problem. When you get into seeking treatment, if that's the way you go, you get into more of, okay, so I have a tendonitis. Why do I have a tendonitis? You know, it's a little bit more in depth than just being able to see it on a video, but we wanted to go through some things that you can look for with your knee. Now, another issue that we have with muscle is muscle weakness, as I just talked about. So what I'm going to let you do is you're going to go and take your phone, or you're going to go in front of a mirror, and you're just going to squat, and you're going to come back up. You don't have to go down very far, just to 90 degrees. Squat and come back up. I'm going to give you a minute to do that. Go ahead. Go in front of the mirror. It's easier if you can record yourself. So if you're watching this on your phone right now, hit pause. I'm going to give you some time to hit pause, record, and then come back. It's going to take you 5 seconds, but I want you to do a squat before we continue, and I kind of give you the telltales of what you're looking for. Because once I tell you, you're automatically going to try and change everything that I tell you to do. But I want you to go ahead right now, do a squat in front of the mirror, and take some mental notes. But even better, do a squat, take a quick video with your phone. Okay, so now you hopefully have a picture of yourself squatting, and you have that saved so you can go look after I'm finished talking of what you look like. So when you look at muscle weakness and you look at muscle imbalances, well, squat's a very good indication of how and what is going on. So most often the biggest problem we see with squats is the knees buckling in and out, all right? This is a very big indication of something going wrong. And if you have knee pain and you squat like this, it's usually muscle issues, okay? It's usually muscle issues that we can correct with various exercises and manual techniques, but it's just you're looking for that in. Now that's a very gross exaggeration of what can happen with a squat. A lot of times it's just more simple like that with the knees going in, but it is, as you notice and as you look, you'll start to see the knees go in, and then as you come up, the knees will go out. Another common thing that we see is once people get to the bottom, they'll rotate a little bit to stand up. Again, this is a really kind of exaggerated version of what people do, but you want to do this, and if you see this, and it'll look something like this. It'll almost be a little flinch at the bottom. Again, there's an issue there. Can it be at your hips? Can it be at your knees? Yes, all the above. Okay, but you're looking for these little deviations in a correct squatting pattern. And the final thing you want to look for is, are you shifting to one side or the other? So are you squatting down and putting a lot of your weight more on one side? All right? Again, it's going to look just more something like this as opposed to all the way over, all right? But look for those clues, all right? When you do a squat, you're looking for, is there muscle involvement in my knee pain? Is there a reason that my knee hurts? Is it because of weakness? If you squat and you see 1, 2, 3, combination of all these things going on, there's your answer. The answer is yes. So thank you for taking the time to hang out with us today and watch this video. Coming soon, you're going to have video 3, which is going to go over some things that you can do at home to start treating your knee.